到时候您放你前面也行。
好，
你省得上上。
好的。哎，刘教授，我陈俊石。刘教授 ，Terrace, are you there?
Can you hear me?
Wait.
Can you hear me?
Yes, we can hear you. Yes, we can hear you.
哎，好的。你已经好的，你已经知道了我们第一个报告人，肖培根院士。
So the first speaker is Professor and academician Xiao Peigen, and his report will be made by one of his students. Do you know that? Okay. Needs to be widely promoted. And our second consideration is that since we are here at the China International Food Safety and Quality Conference, we want to discuss how food and medicine homology, this concept, to its application in the dietary food and products. This is a rather new area, and it's also widely discussed, particularly in the international community when it comes to multinational corporations. Many MNCs have shown their interest in developing homologous food and medicine, but it's quite challenging for them. On the other hand, Many technological developers organization is introduced, including the EFSA from the European Commission, have discussed with us on the idea about publishing and disseminating more food and medicine homology information widely in the international arena, particularly regarding its functions and its safety assessment. And that is why it's the first time that we have this breakout session on food and medicine homology in the CIFSQ. And if this breakout session is warmly received, then we will be holding another similarly themed breakout session during next year's CIFSQ to be held in Shanghai. In this breakout session, my name is Chen Junshi, and Professor Terence Lok-Ting Lo from Hong Kong Polytechnic University, and Professor Liu Zhaoping, Deputy Director General of China National Center for Food Safety Risk Assessment, will chair the breakout session. Before the tea break, all the reports will be moderated by Professor Terence Lok-Ting Lo. And after the tea break, Deputy Director General Liu Zhaoping will chair the latter half, and myself will chair the Q&A session after all the reports are finished. I will try my best to make our discussions lively and successful. Okay, without further ado, I'd like to give the chair's role to Professor Lok. Good morning, everyone. It's my great honor to be able to attend and chair this rather new and promising themed breakout session. And the first report is quite attractive. It's themed on the theory of medicine food homology and its practical significance. And this report originally was to be presented by Academician Professor Xiao Peigen, but he has had other urgent matters to attend, so his colleague and Dr. He Chunnian will present the report on his behalf. Distinguished Academician Chen, distinguished leaders, participants, ladies and gentlemen, good morning. I was asked by Academician Xiao Peigen to present his report. The title of my report is The Theory of Medicine Food Homology and its Practical Significance. I will talk in 4 key topics. Firstly, I want to touch upon the origin of medicine food homology and its theoretical basis. Medicine and food homology can date back to the Shan and the Shang ancient period in China. For the ancient Chinese, during their long years of pursuing livelihoods, they have found this similar nature between food and drugs. They found that there were quite some food and herbal materials in China that can be used both as food and recuperative medicine. And initially, the definitions between food and medicine is very blurred. And it wasn't until the advance of Shennong's herbal classic that the differentiation and a clear delineation between food and medicine came into being. And in this earliest medicine classics, that is Shennong's herbal classic, the food and the homologous food and the medicine can be classified into 3 kinds. The top grade medicine is believed to be free of toxicity and side effects, and it can be taken by human bodies for a long time. So altogether, it identified 120 kinds of top grade food/medicine. And with a surprising coincidence, Hippocrates in ancient Greece is frequently quoted as saying that food be your medicine and let medicine be your food. And this can be seen as the earliest notion regarding the similar nature between food and drug in the ancient West. The medicine and food homology is closely related with many philosophical thinkings in ancient China. Many of these thinkings and thoughts were deeply received by the folklore. For example, according to Huangdi Neijing, an ancient classic, medicine originates from eating when you're hungry. So the things that you eat when you're hungry is called food, but when you take it when you are sick, you can call it medicine. And according to Qianjin Yaofang, first to treat with food. If a food is cannot cure your symptoms, then treat with medicine. The properties of the medicine are strong, just like the imperial soldiers. And it further denotes that the correct use or conditioning of medicine and food is like leading an army of soldiers. First, you need to know the state of the body, including its constitution, symptoms, internal, external manifestation, and then you can choose the correct food / or drugs or medicine according to the theory of traditional Chinese medicine. In such way, the contradictions or the illnesses of the body can be cured. Sorry for the mishap. And in China, the origin of the theory of using medicine and food is closely related to the ancient native philosophy. According to the ancient Chinese, we believe in the philosophies such as man and nature are an integral part of each other. And I also believe that only women have a balanced yin and yang, and having both of the five elements, we can have a healthy body and mind. Food and medicines as essences of the planet Earth, they have similar natures in terms of 4 nature drugs and 5 flavors. So from this perspective, both food and drugs can have very similar ways of use. A complete set of notions regarding food and medicine homologies are comprised of such notions of similar ways of treatment and similar ways of processing. And for the food medicine, how is it applied in our daily dietary? So this is manifested in various kinds of medicated food. We have quite a variety of medicated food. It includes porridge, soup, tea, wine, and medicated wine. From the ancient imperial dynasties to the average livelihoods and folklore, such kind of medicated foods are widely applied and used in the daily families. So it can be safely said that medicated foods has made important contributions to the survival and development of the Chinese nation. Next part, I want to talk about the specific connotations of food medicine.
这个内涵。
Just as mentioned earlier, the food and the medicines are closely related, which is shown very clearly in this picture. And here you can see some food and a medicine. Food/medicine is the overlap between food and medicine, and the boundary is slash line, which also means that there's not a very defined boundary between food and medicine. So the food/medicine includes fruits, vegetables, herbal teas, medicated food, and dietary herbs. And we need to pay attention that food is safe and medicine has its function with some toxicity. So the overlap part of food and medicine means that on one hand it's safe, on the other hand it has some menacing functions. In this way, we can define the food medicine as a kind of non-toxic side effects stuff, which can be taken for a long time with good taste or good palatability, used for chronic diseases and semi-degenerative diseases prevention and conditioning. Because of its nature, it has 3 functions. First of all, it can maintain livelihood. Second, it can prevent disease, adjust the emotions, and third, it can cure disease. And it contains nutritious components, health functional components, and active components. In China, different nations and different ethnic groups actually have different kinds of food medicine. So this picture shows the food medicines development in China. For decades, a lot of research has been carried out, and a list of 110 items have been developed as both traditional food and Chinese medical materials. Up until now, there hasn't been any major safety incidents, indicating that the list of food medicine is pretty safe. In addition to the 110 items on the list, there are other stuff and food medicines. And here are some examples. Like different kinds of tea, like large leaves, kunning cha, small leaves, kunning cha. And here I'd like to give you an example. That is the mandarin peel, dried mandarin peel. And as you can see, this is called chen pi. In Chinese, is here chen means old. According to the traditional Chinese medicine, the longer the dried mandarin orange peel is in store, the better quality of this food medicine. And it has been used to treat distension and fillings in the chest, and aspegastrum with anorexia, vomiting, diarrhea, and a cough with corpus plea. And so chen pi can also be used together with tea for sore throat. It can also be used in medicated food, for example, chen pi porridge, chen pi duck, and chen pi pigeon, to improve the flavor of the food and help digestion. Modern research have shown that the dried mandarin orange peel is very safe. And modern medicines have also revealed the chemical constitutes of chen pi, like the limonin, linalool, etc. And the pharmacological studies shows that chen pi can inhibit the experimental ulcer and gastric acid secretion. It can protect the experimental liver injury, and it also have positive colorectal effects. And next, I'd like to give you more examples of food medicine for chronic disease prevention and anti-aging. COVID-19 has been raging, and some medicines were studied to help prevention of the coronavirus. For example, 白藜芦醇, resveratrol, is widely used in chronic disease prevention and treatment. Caffeine acid is an antioxidant, anti-aging food, and wushen, with 55 foods combined together, is also have anti-aging function. And huangqi, lingzhi, is also widely used food medicine for immune improvement, and anti-aging. Black plum can help tumor prevention and treatment. 罗布麻 also help anti-hypertension and anti-depression. Mulberry leaf is good for diabetes prevention. Tea can prevent cancer and a lot of chronic diseases. The Chinese wolfberry can help cancer prevention and eyesight and intelligence improvement. 清钱柳 is also believed to prevent diabetes. 睡茄 can also help with some neuroderogative disease. Snow chrysanthemum is good for diabetes prevention. Tianma is also good for neurodegenerative disease. Food medicine has been developing for thousands of years. Now there have been some strategic thinking on its development. Because food medicines list need to be updated. The laws regulations for food medicine, the public understanding of the food medicine, as well as the scientific verification and the research about food medicine. So next, I'd like to share some of my thoughts in this regard. First of all, we need to attach importance to the inheritance and the good part of the traditional culture. And we need to think about how to inherit the good part of our traditional culture. On the other hand, we need to adopt modern scientific research. And innovative methods should be adopted, and clinical trials should be used to prove its function and effects. And a modern management and governance system need to be developed for its adoption. And we also notice that different nations and ethnics in other countries also use food medicine. They don't call it food medicine, but in practice, they are used in a wide range of areas. And we also notice that Chinese and different nations can be very different in terms of their food medicine adoption and use. For example, in China, we use yam, lily, and dates together, but a vast majority of countries do not use them. And the Indian ginseng is popular in the international market, however, has not been approved for import in China. So as you can see, there is still a big gap in the application of food medicine in different countries with different cultural backgrounds. Under the One Belt and Road initiative, we need to promote the good Chinese food medicine and introduce the good food medicine from other parts of the world. And we believe food medicine is also a good areas for international exchange. So on one hand, we need to improve the quality of food medicine, especially the high-end products, and build a repetitive brand to sell, to market the food medicine outside China. On the other hand, we need to have more in-depth study of food medicine in other countries so they can be adopted in China. Next, I'd like to talk about the practical significance of food medicine. We know that in modern society, metabolic chronic diseases have become the main factors affecting health. It is forecast that the 5 major chronic diseases are going to cost $47 trillion every year by 2030. And modern medicine also find out that rehabilitation of a chronic disease requires slow and frequent adjustment. So how to deal with the big health problem? We believe the preventive medicine model should be adopted, which is also an important part of the traditional Chinese medicine. So food medicine can help prevent disease and help improve the conditions of sub-healthy status. And food medicine is something we can use on daily basis for anti-aging. Just as Professor Chen said that food medicine have got a lot of attention and it has been the focus of modern research and development.
食品等等。
We have various notions regarding the homologous food and medicine. For example, we can call it functional food, health food, farmer food, phytonutrients, therapeutic food, etc. Despite their different names, they share similar notions regarding the utilization of the homology of food and medicine. And another important trend internationally and domestically is that food and medicine or drugs are increasingly coming toward each other. And in terms of people's dietary habits, people increasingly prefer grains. In terms of their everyday intake of fruits, they prefer nuts, vegetables. And in terms of medicated drugs coming closer to food, they increasingly choose some tonic medicines. For example, the Chinese ginseng, Korean ginseng, etc. You can see, for example, for the example of the Korean ginseng, it's mainly used as a kind of herbal tea. And we have witnessed a similar trend for the Chinese ginseng. As I said, there are international differences or gaps regarding the utilization of medicated food or food/medicine. And we believe the application and promotion of food/medicine has favorable conditions in its international application. We also believe that promoting food/medicine is important for the vast rural communities in China to shed poverty and pursue a relatively well-off life. You know, many of the raw materials of food/medicine are planted in the far-flung rural communities. If this kind of food/medicine can be promoted, it can greatly increase the sources of living for the rural farmers. Therefore, we believe promoting food/medicine is strategically important for China. I will stop here. So much for my report. Thank you. Thank you, Dr. He. we can see the homologous natures between food and medicine brings great promises for future development. In the next presentation, we can have another angle or perspective regarding the food/medicine, that is how to regulate and how to conduct research on the homology between food and medicine. So the next speaker, which we have the great honor to have with us, is Dr. Zhang Lei, who is the head of Risk Assessment Division of China National Center for Food Safety Risk Assessment. And he is also a member of the China Traditional Medicine Safety Evaluation Commission. Dr. Zhang Lei will talk about the status quo of China's management of TCM used as food. Thank you, Professor Law. Distinguished Academician Chen Junshi, distinguished ladies and gentlemen, good morning. I want to thank the organizing committee of CIFSQ for arranging such a breakout session focusing on the homology of food and medicine. I'm with China National Center for Food Safety Risk Assessment. This center is responsible for the management of China Pharmacopedia and also the catalog on substances used as traditional food and medicine. So today I'll be focusing on the status quo of China's catalog on substances, traditional food materials also used as food. And first, I'd like to clear the definition of substances used both for food and traditional Chinese medicine. This notion is widely accepted in China, but with varied interpretations and various names. Sometimes it's called flesh/medicine, sometimes it's called homologous food and medicine, etc. And these differences in interpretation can also been seen in various English translations of this notion. But legally speaking, or scientifically speaking, we call this notion as substances used for both food and the traditional Chinese medicines. Its abbreviation is SUFFAM, SUFFAM. So SUFFAM, according to its legal interpretation, has been traditionally treated as food in the long term and has been listed in the Chinese Pharmacopedia. So these two factors constitute the prerequisites for such a material being recognized as a SUFFAM. But how do we define its traditional dietary history? And right now we define this SUFFAM as a kind of food that has been locally consumed for at least 30 years and by at least 2 counties in 1 province. But we understand that this notion is not stringent enough. For example, how do we define counties? Do we have to specify the size of population in one specific county? Because sometimes a county of several dozens can also be called one county, but the food they consume is by no means can be included in the pharmacopedia. So size is very important. And next, I want to talk about its legal interpretation. One of the legal framework governing the SUFFAM is China's food safety law. According to food safety law, the term food refers to the finished products and raw materials for people to eat or drink, and materials that are traditionally both food and medicine. And according to Article 50 of food safety law, it's clearly defined that no medicine may be added to food and production or business operation, but substances that are traditionally both food and medical materials can be added thereto. Another piece of legal documents that governs SAFAM is what we call document 51. The document 51 is the notification on further regulating the function of food materials issued by Ministry of Health back in 2002. And this document introduces an appendix that listed all the specific SAFAMs. And other documents also enforce, for example, the regulations on prohibiting food dosing. But this document was introduced rather early. It was introduced in 1987, and it was officially abolished this year. And we also have another document introduced in 2014 regarding the specification, the definition of SAFAM. But right now, this document is under revision and is not finalized yet. So you can see that regarding the legal interpretations of SAFAM is still blurry to some extent. Now, I'd like to walk you through the management history of SAFAM. It can be divided into several stages. As Academician Chen mentioned, the notion of food used as medicine enjoys a very long history. But this notion is is regulated legally only in the last 2 or 3 decades. So in the late 1980s or 90s, according to Article 10 of the Law of Food and Hygiene, which is on trial, it is required that no medicine may be added to food, but substances that are traditionally both food and traditional Chinese medicinal materials may be added as more raw material, seasoning, or nutrient supplements. And then from 1983 to 1987, the original Ministry of Health introduced its regulations on materials used both for food and medicine. Fast forward to 1995, the law on food and hygiene was officially published, and it is required that the food drugs cannot be added to medicine, but materials that are traditionally food and drugs can be added as raw materials, seasoning, or nutritional supplements. And then in 2002, the Ministry of Health made a big step forward in terms of introducing the name list for such kind of SAFAM. And according to this list introduced in 2002, there are altogether 87 materials that are included, but only names were shown without specifications on their properties or functions. The stage 3 is from 2009 to now. And food safety law of People's Republic of China was spurred or came into being due to the melanoma incident of the melanoma milk powder incident in China. And a major difference with the food safety law in difference to the previous food and hygiene law is that the list had a much greater detail. It included not only names, but also the properties and functions of such SAFAMs. And China's Health and Hygiene Commission has been progressively upgrading and detailing this catalog from 2009 to now. For over a decade, we have seen very slow progress in augmenting the list. So throughout the past several years, we've been working on introducing regulations on the SAFAM catalog. We've had a lot of problems along the way. In 2019, we added 6 materials to the SAFAM catalog. And these 6 materials, and the reason that only 6 materials were added is based on very stringent concerns of their safety. And these 6 materials were mainly added because of their seasoning flavors. For example, it includes Chinese angelica and the stigma cruxi. And for all other 9 prospective sulfur materials, we have conducted pilot work, again, based on concerns of careful and scientific selection. We mainly conduct pilot work focusing on its potential risks to market regulation and to food safety. Such is the 6 newly added sulfur materials. The new catalog includes not only their name, but also their botanical name, Latin name, their botanical family, the parts included, and notes on their functions. So you can see the new catalog includes much more details compared with the previous name list. It can prevent such issues as unclear usage by the first-line producers. Next, I want to talk about the pilot work on the 9 prospective sulfur materials. Right now, altogether 24 provinces applied for the pilot work on the 9 prospective sulfur materials. And finally, each applicant province can have as many as 3 prospective sulfur materials and pilot work. The pilot work started from 2019, but due to impact by the COVID-19 pandemic and the inexperience, the progress has been uneven. Particularly in 2020, not much progress was made. But starting from the first half of 2021, provinces conducting pilot work have sped up, particularly Shanxi, Yunnan, Gansu, and Guizhou provinces in particular have jump-started or expedited their pilot work, particularly in Guangxi province. Many materials have under license.
In this process, we got feedback from different provinces. Since they identified some technical problems in the pilot projects. So that's why recently we conduct a questionnaire and a survey for the pilot work. And we also conduct on the site survey. In the future, we're going to provide technical guidance for the pilot work. And actually, this pilot projects was distributed to different provinces, and we just provide the scientific and technical support for the pilot work. And the next, I'd like to talk about the application procedures and requirements. Actually, there is no official documents for the application procedures. It's just a letter distributed by the National Health Commission. And now, manufacturers, industry associations, or any individuals can collect some materials to submit application to the Health Commission at the provincial level. And then the Health Commission at the provincial level submit the application to the National Health Administration to put such a material in the list with the supporting documents attached. So then the National Health Commission will evaluate and review the material submitted by the provincial level commission, and then ask our safety risk assessment center to do the assessment and evaluation. And we work with colleagues from our peer organizations to do the risk assessment together to provide opinions. And then we sent the opinion to the National Health Commission. If the answer is yes, then the National Health Commission will put the food on the list. There are some conditions for a food to be made into the list. And so this kind of food medicine is traditionally treated as a food. In addition to the animal experiments, naturally, the performance of people taking this food is another good experiment documents to be submitted. And we also require some documents and materials for the food safety evaluation and review, in addition to the clinical trials. At the same time, we need to comply with regulations for the Chinese medical material resources ecological protection. And when all these conditions are met, we will consider putting it into the list. And if medicine or food is not treated as a food tradition, it's not treated as a food in history, it will not be included. And you need to show strong evidence, especially some survey among people to prove it is traditional taken as a food. And if scientific research proving such a food have a harmful or side effect to human health, we will not put it into the list. So actually you can see the list is updated list. So once you made it into the list, if there's any scientific proof that is not, it has harmful or side effects, or it has some contradictions with the requirements, so that food will be delisted. So this is a dynamic process. We know that a variety of food are taken in China, so some people are a little bit confused about which way for a food to go. So I have a table to help. The first is SUFFAM. The second category is local special food. And the third category is novel food. And the fourth category is functional food material. Well, you need to look at whether the food is in the Chinese pharmacopoeia. Is it traditionally treated as a food? If yes to both questions, you can go to the channel of SUFFAM. If it is only yes for traditional food, then it can be regarded as a local special food. If it is a no to both questions, you can consider novel food and functional food materials. As for the food medicine list, here you can see the application documents required, which is very consistent to the administrative licensing of the novel food. For example, we don't need the application form. However, you need to provide Provincial Health Commission application letter with a proof of traditionally treated as a food. Of course, we need the risk assessment report, manufacturing techniques, the related standards, domestic and international using situation and related safety assessment documents is also required to prove the safety of the food. And this document is especially important among other documents. Other documents helping proving the safety of the food is also welcomed. So the documents required need to provide information in these three aspects. First of all, the basic information, including the Latin name, breed identification, edible parts, and second, need to have the ingredients analysis, and the third is the toxicological information, including some research paper. And the edible, the fourth aspect is the edible and using conditions, emphasizing on the history of this food taken by people. And the fifth aspect is manufacturing techniques, and the sixth and the other includes sanitary inspection report, quality specification, and other standards, as well as other assisting documents. So I just walk you through the application procedures and requirements. As I explained, there's no official procedures and a process yet. There are still some areas for improvement. And next, I'd like to talk about the standards of food safety for the food medicine list. And actually, nearly 50 SUFFAMs not included in food safety standards. And some Chinese pharmacopoeias emphasize the therapy, lower limitation of extraneous hazard. And the problem brought by lack of food safety standards of SUFFAM, such as imported Crocus tavis. And we also need to, there's also some questions about whether we should formulate or sign food safety standards for SUFFAM. And we come up with some solutions to deal with these questions and problems. For example, we can comb through the standards, collect the data, and conduct the risk assessment. And we can also assign standards such as we can also develop or designate the standards for SUFFAM and formulate standards based on the risk assessment if necessary. So this is something we have been doing recently. We conduct a workshop not long ago to share our ideas on this regard. We don't have enough raw materials or raw data. So we need to collect more data for assessment. For the 100 items on the list, we can maybe designate some standards for them. For any special items on the list, we can develop limits for such kind of food. And a lot of consumption is in a fresh and a dry way.
Some are processed as dried medicated pieces or decoction pieces. Some are eaten fresh. So when we decide or regulate the standards, we should determine on the specific regulations or specific requirements on the edible parts and their ways of eating. In the future, for the newly added SUFFAM materials, we may have to consider how to set up the standards before their addition, so that once they are added to the catalog, their regulations are already there. And in terms of in the process of assessment, we have also encountered some technical issues, and there are quite many of them. First, how to define the notion of long-term edible history. And secondly, how to define the traditional Chinese medicated materials. And our current definition is that the materials that are included in the Chinese pharmacopoeia can be called as TCM materials. But aside from this pharmacopoeia, we also have provincial standards on SUFFAM and on food and medicine. So can these standards or can these catalogs be combined into one, and can they get harmonized between each other? This is another pending question. And thirdly, in terms of the Chinese pharmacopoeia, it it's under constant improvement upgrade. Sometimes and some materials are added, some materials are deleted. So do we need to upgrade our catalog in sync with the revisions of the pharmacopoeia? And the fourth question is that for the materials that are added in the pharmacopoeia, if it's already under administrative or local food administration, does it still need to provide a full set of safety evaluation materials? And again, do we have to limit its target population and its prescribed daily intake? It's closely related to its safety. Again, we have other issues regarding the parts, the edible parts, and its parts for to be included in the pharmacopoeia, etc. So all these issues need to be resolved from the perspective of pharmacopoeia. In terms of regulation, the watchdog is the National Commission on Food and Safety on food safety evaluation. But right now, we have increasing demand for the increased variety of food and its safety evaluation and administration. So variety and safety sometimes can come in contradiction. According to the National Watchdog, the basic principle is that by increasing regulation and by improving our services, we can provide more varieties of food and food/medicines with the overarching principle of safety. As a Center for Risk Assessment and Safety Evaluation, our center is committed to conducting consistent safety evaluation and assessment research so that we can ensure that the SAFA materials are safe and sound. Thank you. Thank you, Dr. Zhang. In the interest of time, let's hold our questions to the Q&A session at the end of the breakout session. The next report is also very important. It focuses on the safety evaluation of substances used for food and drug. We have the great honor to have with us a research fellow, Dr. Ma Shuangcheng, the director of the Institute for the Control of Chinese Traditional Medicine and Ethnic Medicine. Professor Ma Shuangcheng is a very prolific researcher, and he has undertaken many important TCM-related projects in China's 13th five-year development period. And aside from his capacity as the director of the NIFDC, he's also the chief scientist of the Institute for TCM and Ethnic Medicine. He's a very rewarded research fellow. Let's welcome Director Ma Shuangcheng. Academician Chen, Professor Luo, and distinguished speakers, ladies and gentlemen, for attending this breakout session. I'd like to especially thank Commission Chen for inviting me here because my institute focuses on the evaluation and examination of drugs. So we mainly focus. So I'd like to mainly focus on how we have conducted safety evaluation of the SAFA materials. The two previous speakers have both touched upon the notion of what can be called homologous food and medicine, or what we call SAFM. And as people's livelihoods are constantly improved, people have more demands for keeping health and fit. Increasing the consumption of the sulfur materials is increasing sharply, but because of due to the lack of concern for the safety and for the maximum daily intake, there have been some issues, health incidents related to the consumption of sulfur. As we said, food and medicines cannot be clearly separated from each other. A basic difference between them is food is something we eat when we're hungry, while medicine is something we take when we feel ill. And I think previous speakers have touched about the 2012 name list of sulfur materials produced by the National Health Commission. And in 2014, the National Health and Family Planning Commission upgraded the list with 15 additions. And again, then in 2019, 9 additions were introduced. But these 9 materials, I can only allow it as a sulfur with clearly defined scope of use and daily intake and dosage. What are the characteristics of the sulfur? They are bulk products. They are subject and large intake and a long intake cycle. So because of these 2 materials, their safety and their health risks to the human body are warrant specific concern. For example, let's talk about ginseng. Ginseng is a large variety with a bulk consumption and intake. In northeast China provinces alone, they produce a ginseng of 20,000 tons annually. And in 2002, after the Chinese ginseng is listed as a sulfur material, many problems cropped up. For example, we have required that these ginseng, the sulfur-listed ginseng, must have a minimum planting area of 6 years. But actually, many ginseng are harvested with a planting with a growth period of less than 6 years. Another case is with the Chinese wolfberry. And Chinese wolfberry is widely taken as a fruit or as a vegetable by the Ningxia Autonomous Region and many other provinces. According to the Chinese Pharmacopedia, its prescribed daily intake is about 6 to 12 grams. But in actuality, when they are taken as a kind of food or as a fruit, and the daily intake far exceeds 12 grams. Another issue with the safety is its safety, or is with the over residue of pesticides. When these food are harvested for processing as traditional Chinese medicines, there are many production stages that are prone to pollution and pesticide residue. And because these sulfur are taken much more frequently than the normal medicine, it's imperative that we conduct a safety evaluation of the sulfur materials. Therefore, starting from the 10th 5-year period through the 12th 5-year period, we have undertaken various national key projects to assess the exogenous toxicity and the safety evaluation of over 200 varieties of common TCM materials. For example, in the 10th 5-year period, we studied on the detection methods and the limit standards of harmful residues in 50 common traditional Chinese medicines. And in 12th 5-year plan, we established a technical platform for quality and safety inspection and risk control of traditional Chinese medicine. According to our research, we assessed 120 kinds of commonly used TCM materials and decoction pieces. And you can see that honeysuckle ginseng, American ginseng, Chinese blackberry, chrysanthemum, panax notogens, and tangerine peels are detected with a relatively high pesticide residue. And we also conducted detection on the heavy metal pollution. For the specific TCM materials, they are particularly subjected to pesticide pollution. And many materials, for example, the Ligusticum transhuhot and the Coptis genesis, they are inherently subject to accumulation of pesticides and heavy metals. So in 2014, NMPA implemented a risk early warning system, which is mainly aimed at excessive agricultural and veterinary drug residues, heavy metals, and other harmful pollutants in food. Risk assessment of food chemical can be generally described as characterizing the potential hazards and the associated risks to life and health resulting from the exposure to chemicals present in food over a specific period. And risk assessment on food and drugs provides the scientific basis for formulating and revising relevant safety standards, implementing safety supervision and management. Both in and outside China, we have various watchdogs on the safety evaluation of food and drugs. For example, in China, we have CIFSQ. International, we have FAO and CSA. And we have attended multiple meetings of CCPR on behalf of China. And in the annual meeting of CAC, when they are drafting the international pharmacopoeia, China have also taken the opportunity to establish a national pharmacopoeia commission. Together, we conducted the safety evaluation of exogenous hazards to food and drugs. And we have made a lot of achievements. For example, our standards regulations on the exogenous hazards to sulfams have been included as an appendix to the Chinese pharmacopoeia. We have conducted safety assessments on over 20 varieties of kinds of heavy metal elements. Next, I want to introduce the basic flow diagram of risk evaluation. I think you are quite familiar with them, so I will skip this part. And the first part of risk assessment is hazard identification. And the second is hazard characterizing. And we use the health quantitative or quantitative description or reference standards that are already established. Or if without such established standards, we will use reference and approximate calculation to establish such risk thresholds. And thirdly, we also conduct exposure assessment. What's different with TCM from food is that it has a very specific characteristics regarding its intake. We have food every day, but we don't take TCM every day. So when conducting assessment on the daily exposure, we have innovated on the calculation formula. The formula for calculation exposure dose can reflect the usage characteristics of TCMs.
And this formula is also adopted in our assessment process and program. And actually, the parameters of this formula are based on on-the-site investigations and research. For example, the frequency, the exposure duration, and the daily ingestion rate, etc. As well as the average exposure time to TCM, which is about 90 days on average. And actually, I just want to say that this parameters is based on our 1-year research program. And then the risk characterization is a comprehensively analysis of the risk based on the results from the hazard identification, hazard characterization, and exposure assessment. And there are two methodologies for the risk characterization. One is the margin of exposure. The other one is a hazard index. I believe you are familiar with this, so I will not go into details. Here is the HI method. The others is MOE method. And next, I'd like to give you an example. The risk assessment of pesticide residue in the food medicine. The primary purpose of this assessment is to provide principles method for risk assessment of pesticide residues in high-risk pesticide indicators. And actually, in 2013, the Chinese herb tainted with pesticide not safe to consume is as a title used by Greenpeace to attract attention from the media. Actually, they pick up the herbs with relatively high pesticide residue. And we also conduct a lot of research and testing of this. And we have found the quintonzine for the rest of the pesticide is not very much. And actually, you can see that most of the detected pesticides are not toxic. And if we take the ARFD and the ADI indicators, so you can see that despite all this pesticide, the risk is still relatively low. And only the quantizine is a little bit higher in terms of exposure. For the rest, is pretty good. And we also adopt the veterinary residue committee of VRC, to do the assessment, to risk assessment. So you can see all these calculations, and then we got this score, which is still relatively low, and only only a few chemicals deserve our attention. And actually, most of the chemicals are already covered in our previous assessment, and only PCNB deserve more attention. And here you can see that for the other four pesticides residues, including the hexachlorobenzene, folate, PCNB, and the BHC, were classified as a high-risk group. The other sample is goqi, Chinese wolfberry. A lot of international attention has been given to that, and some of the Chinese wolfberry exports suffer from the returns or distractions. And we also had some risk assessment. And we detect 31 chemicals. And for 70% of the samples, we identify 15 to 15 chemicals. So there's different chemicals residues in Chinese wolfberry. But actually, you can see for the risk assessment, the risk is relatively low. And we found that the carbon fuel rate is actually relatively high, and which is actually on the banned list of pesticides. So carbon fury is something deserve more attention. And this is a cumulative risk assessment. And we also find that the risk is acceptable. Another example for heavy metal. Heavy metal is also regarded as a severe problem because it can be accumulated in the body and it cannot be degraded. So we adopt ICP-MS method to measure the contents of heavy metals. And we also conduct test of more than 9,300 samples. And you can see that the mean level is not high, and the main risk factor is the elements is one element which is related with fertilizers applications. And the other one, you can see for the Chinese dates, for the peppermint, Chinese algae, etc. The evaluation of their heavy metal residue is also acceptable. This is the Chinese Agilica as an example. We collected samples from Gansu province and a few other provinces. It is still acceptable. The other risk assessment is aflatoxin. This is very toxic element. If it is taken into the food chain, it will have a big impact on people's health. And it can also be contaminated in the transportation process. So here you can see the detection results. And actually the overall detection rates of aflatoxin was about 7.7%. And even based on the most stringent EU standards, the qualified risk exceeded 95%. However, the semen nullibinness is risky because the detection rates is about 81%, and the failure rate is up to 72%. Even though the overall detection rates of aflatoxin in TCM is generally low, however, some varieties of great concern. For example, the semen pruning persicii, the semen ziziphus snowsea. And a lot of the food medicines actually are processed before eating. So actually we find that the transfer rates of PCMB in three processing methods like water decoating, water immersions, and the bite of the acetal extractions were studies. And we found that actually the transfer rate of PCMB is not high at all. So I believe that this transfer rates of a heavy metal should be considered in the research and standards development. Without considering transfer rates of heavy metals, you may set up too high requirements or standards. And finally, I'll talk about the technical guidelines for the risk assessment. And we submit three guidelines to the international for WHO, and we also have for data analysis and risk assessment system. Have the database, and based on the data collected, we can do analysis in the system to do the risk assessment. And some categories can be selected for targeted evaluation. Finally, a conclusion. I have been doing risk medicine of Chinese medicine for a long time, and I believe this is also applied for the medicine, food medicine. And I think food safety is a priority for food. Actually, what we are doing now is about safety and of medical food. And I believe food medicine is a big sunrise industry. More attention and support should be given to standards development. So a more systematic risk assessment method has been established by this research on the detection of technology risk assessment method harmful substance in TCM, which provides technical support for the improvement of quality standards and the supervision of TCM. And I hope this is the first workshop on the food medicine. And I hope that this workshop will attract more audience and players. And I hope that safety will be a good pillar in this area. Thank you. Thank you. Thank you, Mr. Ma, for your speech and a presentation. So, any questions or comments from the audience to these three speakers? I'm on the side. It is easy for me to see hands raised in the audience. Okay, please give him the microphone. Please identify yourself first. I'm from the assessment center and the public security ministry. And I can see that the safety assessment is more about external contaminations. For example, the medical, the chemical residues, etc. But what about the interior, the internal elements of the food medicine?
So about the edible or medicated food, before we listing them into the catalog, we would have conducted research on the exogenous hazards and duly and amply. We must make sure that it is safe and it has a long and very stable sized target population for use. So this long history of dietary can itself prove that they are safe to use. And for the inherent hazards, I don't see there are any material or substantial hazards related to their inherent properties. So when we talk about safety evaluation, we indeed only focus on the exogenous hazards. But for the inherent hazards, we mainly focus if they are toxic, or if they are toxic, particularly for the toxicity of toxic plants and their specific toxicity and working mechanisms. And another Speaker who wants to raise a question. Thank you. I am from the Beijing Universal Resort, and I work in the dietary department of the Beijing Universal Resort. And I'm curious about the pilot work on the 9 prospective sulfur materials. If Beijing is not included in the pilot work, can Beijing use these 9 prospective sulfur materials as sulfur? And another question is that I can see that you have very specific daily intake dosage for our for restaurants and dietary restaurants. How should we use this dosage? Well, about the pilot work. So the question is about whether the local standards of practices can be promoted nationwide. If you want to apply for the production of sulfur material in Beijing, you have to clearly define that which material you want to use and produce in your province. And it depends on the local supervision methods. And actually have raised a quite a chronic issue. I know that for sulfur materials that are allowed to produce in provinces, and it may not be allowed for sale or for production in other provinces. So you can see there are some jurisdiction issues regarding the regulations. For the catering service providers, I think there is quite a high risk involved in using the prospective sulfur at current stage. Another question is about the dosage. So actually for the sulfur catalog, there is no specific definition on the dosage and on the population, but the catalog doesn't clearly define the dosage because if sulfur is treated as food, then actually there shouldn't be any prescriptions on their dosage. Another reason for removing the dosage is based on rounds of evaluation and considerations. The sulfur is used for many symptoms or syndromes that are mild in nature that can pass after a specific period of time. So I think when this material is used as sulfur, and as long as you use it in a normal way or in a traditional way of eating, so it's totally safe. Another question? Thank you, Academician Chen. I have 2 questions. I'm from Pepsi. So as a follow-up on the question from the Beijing Universal Resort, I understand there are 9 prospective submaterials that enter pilot work. So is it true that these 9 prospective submaterials cannot be used or produced outside these pilot provinces? So my question is, how long will this pilot work take? After how many years, a period of time, will these prospective materials be officially included into the catalog? Another question is that there seems to be no specific food safety regulations or laws regarding the sulfams. So this sulfams can only, so manufacturers only refer to the pharmacopoeia. But actually, for example, if in the pharmacopoeia, the plant is included in the pharmacopoeia, but in sulfam we use its edible roots. How is it allowed? Okay, so for your first question, the Ministry of Health is considering how to conclude the pilot work and what are the thresholds for the eligibility of the prospective 9 sulfur materials. So I don't have a clear answer to your first question. It depends on the final decision from the Ministry of Health. And on your second question, As shown from the table in my presentation, it's clearly required that the parts used as a sulfam must be strictly the same with the parts included in the pharmacopoeia. So both the name and the parts that are used must be the same for sulfam and for the thing in the pharmacopoeia. Thank you. Okay, another question? From the Chinese National Academy or Institute of Food and Traditional Chinese Medicine. I have a question which is related to the remarks of Professor Zhang. For example, the national standards for food, particularly in the hazard control, is quite different from the pharmacopoeia. So my question is that when you drafting or upgrading the standards regarding the pharmacopoeia, which standards do you refer to? The second question, which has pegged me for quite some time, is that when we in the pharmacopoeia, when we talk about some traditionally used food, for example, the hawthorn, we actually have these contraindications listed. And let's take the example of hawthorn. In the pharmacopoeia, actually, it's there are some contraindications listed, but in the catalog, there isn't such indication. So do we have to harmonize between these two regarding the contraindications? Well, this is a hot potato question. Who has the courage to take up this? Our special guest here, Professor Chen Ming, wants to try this question. Thank you. I will try our best to use my experiences to take up this question. In the sphere of traditional Chinese medicine, we divide people according to their different constitutions. So even fruits, because of their different flavors and natures, of course, they have different suitability to different constitutions. For the sulfam materials, one class of sulfam is called top-grade material, top-grade medicine. Of course, they will have different impacts on different people according to their constitution. So my experience is that you have to pay close attention to your symptoms and to your responses to this kind of sulfams. For example, when we call with a jujube, everyone knows that jujube is good. It's good for circulating and activating your blood. It's good for maintaining the ample blood flow in your body. But for me, jujube is definitely not a cup of tea for me, because everyone I has jujube, I get extra heat within my body and I feel under the weather. So I know instantly that jujube is not for me. So I think for our TCM researchers, we have to do a lot more public education from the perspective that you have to know your constitution and you have to know how to choose the best varieties of different kinds of sulfam and how long you should take them. Thank you. Well, I think Professor Chen has answered the question really well. And I will also try this question. You talk about the hawthorn. And the regulation of sulfam will never define the target population or the dosage for sulfam materials such as hawthorn. Because when we talk about regulations or national standards, it's inherent a law or a prescription. Hawthorn, as a kind of material used for both for food and medicine, if we are to prescribe its target population or its dosage or its ideal age group, it's not idealistic, it's not operable. For example, we know that we have a very popular about the jujubes or hawthorns on coated jujubes on sticks. Because it's a very popular food, can we define this? Which kind of population can take this food? It's not operable. If we don't have any other questions for this presentation before we have a tea break, I will try to wrap up this session. Our discussions raised a very important question, which originally I would like to reserve for our ending discussion. So this question is about the standards on the pollutions to the cell phone. Previously, Professor Ma has clearly talked about their data-driven and science-based research on the pollution. But actually, these standards on research are focusing on medicine or on drugs. But when it comes to food used as medicine, the standards or the pollution control standards must be different from the standards on medicine or drugs. For medicines, we have clear national standards on the allowed maximum pesticide residue, but such standards have not come into being for cell phone, and these standards must be there without any negotiation. So for safety evaluation of cell phone, imperative or urgent work is establishing the safety and quality standards on cell phone. I will just throw out this question at this stage, and I look forward to heated discussions on this issue. On the one hand, we hope this cell phone catalog can become larger and be more detailed. On the other hand, we also hope that this catalog can be backed by science and by very clear and ample research. We will have a tea break for about 15 minutes, and please be back in 15 minutes. I'm very glad to have such a large population here. So see you in 15 minutes.
好，各位现场和线上的参会代表，请做好准备。我们这个专题还有3个精彩的报告。我是来自于
So let's start the next session this morning. I'm Mr. Liu Zhaoping, Deputy Director General of China National Center for Food Safety Risk Assessment. It's my pleasure to be the moderator for this part. We have 3 speeches. The first speaker is this Mr. Shi Liyan, distinguished professor from the Institute of Food Science and Technology, National Taiwan University. The topic is dietary therapy is an Asian wisdom in traditional Chinese medicine as a preventive medicine. Professor Shen is a well-known researchers in this in preventive medicine. He also take roles of other institutions and organizations. So I'm going to give the floor to Professor Shen. Due to the pandemic, we are going to play the video tape of Professor Shen's speech. First of all, I'd like to thank the conference for inviting me to talk about dietary therapy. Asian wisdom in traditional Chinese medicine is preventive medicine. Can food be dietary remedies? This is a question asked by a lot of people. And however, 2,500 years ago, Hippocrates said, "Let your food be your medicine and let your medicine be your food." It means that food is the best medicine. And around the same time, the first Chinese medicine book, Huangdi Neijing, also said that the medicine and the food are the same source. So in this book, it mentioned Shanggong is the best treatment is to prevent the disease from happening. So you can see that Huangdi Neijing is give more attention to prevention instead of treatment. And in 2018, paper mentioned a national survey from the World Health Organization shows that 75% of people are in subhouse state. And people in the subhouse states deserve more attention from society because we can prevent them falling into illness. So this is a very important work that is preventive medicine. In 2003, Nutrition Research Review a very important international journal, Professor Shimizu pointed out that there are 3 functions of food, and most people are aware of the first function, that is nutritious function. And people are not familiar with the other 2 functions. And actually, nutritious function is the basic function of food. In addition to that, we want some delicious and flavorful food. That is the sensory function, the second function of food. And the third function is the physiological function. which is to improve your health. So this is about the three functions of food. Nutrition function is the basic. In addition, on top of that, we want to have a sensory and a healthy function. And in this dietary therapy in the ancient Chinese medicine books, it collects a lot of dietary therapy in ancient Chinese medicine for thousands of years. So it means that dietary recipe is an important part of the traditional Chinese medicine. And we should give more attention to dietary therapy, which is which can take care of a big population. At Taiwan National University, I call my laboratory of dietary therapy. Garlic, gingers, lingzhi, and coffee and some daily food are studied in our laboratory of dietary therapy. And we look at these foods in three aspects. First, brain science, focusing on depression. Second, liver protection from liver cancer to early stage of disease, that is a fatty liver disease. And the third aspect is the microbiota and microvolumics. And we try to identify its food's relation with obesity and disease. The fourth aspect is food safety and preventive medicine. If any problem in terms of food safety, the food is not edible, should not be eaten. So I believe that safety is the fundamental of food. And we did some microbiome assessment. And we try to conduct our research under the guidance of preventive medicine. And we try to conduct a precise medicine research because we hope that we can have a precise food intake. It means that you need to understand the food attributes. Food can be put into four categories: cold, cool, hot, and warm. For example, chili is a hot, ginger is a warm. As for hot and warm food, we call them yang food. As for the cold and cool food, like watermelon, coconut water. So cold and cool food is regarded as yin food. Therefore, there's yin and yang for food attributes. And actually, people's body can also contains both yin and yang elements. And on this slide shows ginger. I mentioned that ginger is warm in terms of attributes because it has the active compounds like gingerol, chapeau, gingerine. So these components will make people feel warm. So that is why ginger is a warm food. As for coconut water, it is cool or cold in terms of attribute. It also contains a lot of vitamins, minerals, photohormones, growth promoting factors. So it is regarded as a nutritious food. So I mentioned that food can be separated into yin and yang. And to have precise food intake means that we need to take the right food based on your own constitution. For example, if you are a hot constitution, you sweat a lot, you feel hot most of the time, and you feel tired. And this is the features of a hot constitution. As for the cold constitution, people have diarrheas quite often. And this is the cold or yin constitution. So for people with a hot constitution, should eat cool or cold food in this way to strike a balance between yin and yang. If you have a cold constitution, you need to eat more warm and hot food. In this way, you can also achieve the balance between yin and yang. So that is an important part of the precise food intake. A few years ago, a PhD candidate did research of people of constitution eating hot food. He found that the caterpillar red blood cell velocity actually got higher in this condition. With laser Doppler anemometers, we can see a lot of red blood circulation in the nails. So if you are of a hot constitution and eat hot or warm food, the red blood cells flows very fast, so you don't feel comfortable.
Therefore, maintaining an yin and yang balance is quite important. If you have a constitution of hot and cold, you need to intake in cool or cold food so as to make yourself feel comfortable. And we have written a paper focused on the theme, which is published in a very important high impact factor journal. Due to the impact of a COVID-19 pandemic, we have quite strong feelings. As early as in 2008, WHO had predicted that by 2030, the depressive disorders will top all the disorders wreaking havoc with the human body. Depression actually is quite a permissive disorder. When you feel blue for quite a period of time, it may lead to depression. And depression in turn may trigger other disorders such as Alzheimer's disease, Parkinson's disease, and in these worst cases, it may lead to dementia. And if we have a family member who has dementia, we may feel great pressure and our family life may be damaged. In a lot of published papers, it's quoted as depression may be a risk factor for dementia. And stress is a major factor, is a major trigger to depression. When under chronic and severe stress, people may have depression. And for the people who have depression, 30% or 50% may further develop Alzheimer's disease. And for people with Alzheimer's disease, 60% to 70% may further develop to dementia. So if it is developed to the stage of causing dementia, there is perhaps no point of return for recuperating such kind of patients. Therefore, we need to treat the symptoms from its sources. That's we have to remove the stress factors so that people can prevent themselves from developing depressive symptoms. For people with depressions, they need to take antidepressants. But according to some published papers, antidepressants may have some side effects such as sleep disorder, gastrointestinal adverse effect, nausea, vomiting, and weight changes, etc. Therefore, if we look at the mental health treatment preferences, only 10% chooses medicine or medicine only therapy for treating their depression disorders. Therefore, these discussions or observations lead to this begs this question of what can we do to address depression disorders. And actually, Gastrodiol alert BI may come into play as a very important treatment therapy. The picture in the lower right bottom shows fresh plants. And the upper right picture shows its dried plants. And the picture in red shows the decoction, the processed decoction pieces. Tianma, which is its common name for the Gastrolida elata bloom, has many traditional uses, such as treating dizziness, paralysis, epilepsy, and convulsion. For the sake of conciseness, we will only call TMI as GE. GE is an important ingredient for dietary therapy in traditional Chinese medicine. And it is widely used in many medicated food. For example, we have a popular food, medicated food, such as chicken soup with GE. And for vegetarians, they prefer papaya soup with GE. In about 20 years ago, GE had been tentatively used as a potential antidepressant. We applied forced swimming test or FST to test if GE has potential antidepressing potentials. Therefore, we used FSD to appraise the potential of GE in damping depressant. The first step is we put guinea mouse in water cylinder. The guinea pig will be very nervous and he will struggle to swim. And because the another thing, adrenaline's vast secretion, the mouse will swim frantically. And for some time, when he realized that he cannot escape, his brain will secrete a 5-HT, a serotonin. And after the secretion of a 5-HT, you can see that his hinder legs are still moving, but his former frontier legs are like swimming. This indicates that the mouse actually is relaxing a little bit. We call this time for swimming time. And then after he realized that he cannot escape, but whatever means, he loses hope. He stops moving with both his frontier and hinder legs. He is overwhelmed by hopelessness. And this time we call immobility time. And this immobility time denotes depression. The longer he is subject to immobility, the more potential he will develop depression disorders. And then we dose the guinea pigs with GE, water extract of GE, and researched on the antidepressant effect of GE for rats. And we were glad to find that for the rats that had intake of water extract of GE, their immobility duration were invariably lower than that of the control group. This indicated that they experienced shorter depression times, and this indicates a positive effect of antidepressant in GE. Then we took the brains of the rats and analyzed the different brain regions related to emotion, for example, cortex, striatum, and amygdala. And we researched on the neurotransmitter, the number of the neurotransmitters, which indicated the concentration of the neurotransmitters. And these we researched on FHA, NE, dopamine or DA, and other materials such as 5-HIAA, DOPAC, or HVA. And we were glad to find an important result that for the rats that have taken water extract of GE, the concentration of 5-HT and DA or dopamine there's two neurotransmitters. The concentrations of these two neurotransmitters were higher than those concentrations in the control group rats. This indicated that after intake of water extract of GE, their antidepressant potentials were higher. And in terms of the turnover rate of the neurotransmitters, we find that for the conversion from 5-HT to 5-HIAA, the rats with HWGE was much lower than those in the control groups. And in the turnover between DA and HAV and DOPAC, rats with HWGE intake had lower concentrate turnover than those in the control group. So this indicated that in terms of the turnover between different neurotransmitters, the intake of GE can help maintain a stable concentration of the neurotransmitters. Our research concluded that GE is important potential food with great potentials for medicine. After research, our researchers are really happy with our result. And we were hopeful that if we can use appropriately with the materials for both food and medicine, we can not only enjoy delicious food and also enjoy good health, happiness, and live a happy and fulfilled life. So much for my presentation. Thank you. Good morning, everyone. My dear friend, academician Professor Chen, my dear friends, good morning. First, I'd like to thank academician Chen and the organizing committee for giving this opportunity to share my insights on the research of SAFAM. I've learned really a lot from our discussions and presentations. I hope that we can further discuss with each other so that we can promote the traditional materials used for both food and medicine, which enjoys thousands of years of tradition in China, can really prosper along, and we can contribute to improving the health, both mentally and physically, for the sub-health groups of population. Thank you. Thank you, Professor Shen, for introducing Taiwan's research experiences to update on the food and medicine homology. And for the presentations so far, we've mainly introduced about the relative definitions and notions of the food and medicine and some inherent issues. And the next presentation focuses on a very specific material, that is Magnolia officinalis. And for this topic, we have the great honor to have with us Tian Minming, Senior Research Scientist from Mons Wrigley Company. A research fellow Tian Minming has a long research record on TCM used as a food, and with a specific case of Magnolia officinalis, it has successfully been used as an effective element to be used in chewing gums, both in EU and in United States. Dr. Tian will introduce his presentation online. Dear chairs and dear participants, can you see my slides? Yes, we can see your slides.
我想
你要
调节
I'm trying to figure out how to move my slides. Is it on full screen now? Yes. Yes, it's on full screen. Dear Chair and dear participants, I'm Tian Minming from Mons Wrigley Company, and I'd like to thank the organizers' invitation for talking about our cooperation.
Our research on the Chinese herb Magnolia bark extracts And the topic is oral health benefits of sugar-free gum containing magnolia bark extract, a traditional Chinese medicine. I'm going to talk a few things. First of all, the benefits to how oral health. Second, the selection of the traditional Chinese medicine. Second, some of the research we have done about the magnolia bark extracts in the gum, and then finally, I'm going to talk about the toxic and regulation compliance. Sugar-free gum actually have get a lot of attention recently. For example, it can help the secretion of salvia. It can also help with the disease, help prevent disease of the tooth and teeth. And here you can see the experiment result. The gum actually can secrete to help the secrete of saliva, especially the calcium in the gum can help with the calcium retention in the teeth. And this page shows the benefits of gums to prevent dental plague or bacterial plague. You can see that if you take a gum for 10 minutes after each meal, it actually can prevent the secretion of some acid, which can help reduce the dental plague. Just as the moderator mentioned that traditional Chinese medicines have got our attention because now a lot of the toothpaste, etc., contain a lot of man-made or synthesized compounds, which can be toxic and have side impacts on people. For example, a compound in the Colgate toothpaste was recently banned. And for a lot of traditional Chinese medicine, they actually don't have a very big toxicity in itself. However, for the traditional Chinese medicine, the problem is that we don't have, there's not enough academic research about the traditional Chinese medicine. That is why there's not a lot of licenses being given to the Chinese medicine to be used in food. So we work with the second medical school in Shanghai and the oral medical school in Shanghai to conduct short-term, long-term, and midterm toxic studies of the hope, the magnolia bark extracts. So this is the selection of the traditional Chinese medicines in the bacterial prevention. For example, Hualian Zicao, hope actually can resist or can help reduce the bacteria. And in terms of cost, taste, textures, etc., we finally put hope as our top priority. Hope is a magnolia bark extract, MBE. It has been used to reduce pain and stress. And however, there's not enough research in its toxicity. And there are 3 different extracts for MBE. For example, with carbon dioxide, we can get a high purity MBE. And here you can see the main extracts by the three different extraction methods. So if we use the water decoction, it gets different compounds in the MBE. But with the carbon dioxide method, we can get very high concentration of MBE. So to be more precise, we use HPLC to do the compounds testing and control of in the MBE. And we also ask a third party to do the research and testing to ensure the quality of MBE. And here, this page shows the MBE concentration at different time after the gum chewing, and the result shows that when the gum is chewed and the MBE is released into the mouth gradually. And this picture shows the pill containing MBE impact on the bacterial prevention. And we found that the MBE actually have a big impact, and it can be as high as 7.5 ml. And we also find that within 2 minutes, MBE can kill 99.9% of the oral bacteria. In addition to that, we also conduct the biomembrane testing. MBE is used in once a time or many times a day. We find that MBE all have a big impact on bacterium prevention. And then we have experiment with a group gum and MBE gum. For experiment, we found that within 40 minutes after chewing the gum, the MBE gum group reduced the oral bacteria by 43%. And however, the control gum group only reduced by 18%. And this is a research we did together with university. And we have a double-blind full-leg crossover RCT clinical study. So for the respondents, they didn't use other oral house method. They only use gums 5 days a day. And from this research, we can see that gum actually reduce the total amount of bacteria, and it also have a prevention of dental plague. And this research result was approved and adopted by a journal very quickly. And this is another project together with a university. This shows MBE actually can increase oral bacterial cell surface hydrophobicity and improve the cell perceived breath freshness when added to chewing gum. So this is very important for consumer products. And we also conduct mass microbiological adhesive experiments. In the experiment, MBE was mixed with some bacteria, and then to test the amount of bacteria, and we found that MBE actually can effectively reduce the bacteria from the mouse. And the right-hand side shows the speed of clearance depends on the categories of bacteria. And for example, the F. New Clinton is removed much faster than P. Givavilus. So mixing MBE with other compounds can help reduce the bacteria or the deadly bacteria in the oral chest. And we also find that MBE can help with inflammatory. It uses ephedrine to do the anti-inflammatory results. And we also add some chemicals in it to look at the expression of different kinds of inflammation. And we found that if we add 1 to 10 MBE, it can reduce the RAs, IL-8 expression and reduce MP2, MP9 expression. And we also found that MBE together with other extracts can have synergy effects. I mentioned that the biggest barrier for traditional Chinese medicine in food is the toxical research. So together with the Disease Prevention and Control Center of China, we conduct a joint research, and the results has been released and in a lot of publications, including the short-term, long-term, mid-term toxicity research, and we found that there's not a big difference when you add MBE in the materials, and we haven't found any genetic toxicology, and we also found that most of the MBE will be released by liver, and 10% of the MBE will be released by urine. So we did the data collection and analysis, and then we have a panel review of our research, and we believe that the MBE, especially MBE from the carbon dioxide way, is safe as a food additives. And then we submit the experimental result to the international fragrance organization, and it's accepted as a FEMA. And then we got EFSA's approval as a new food. And you can get more information from the website link. And in conclusion, sugar-free gum is good for oral health. For example, APA, seal. And if MBE is added into the sugar-free gum, it will be more effective in oral health.
Both in vitro and in vital experiments have shown that MBE can remove interdental debris, reduce oral dryness, and reduce the incidence of dental cavities. And it is also helped to increase saliva flow and remineralize teeth. Chewing gum containing MBE also has additional oral health benefits, such as inhibiting oral bacteria. And sugar-free chewing gum containing MBE has good cleaning effects. It can shows high removal rate of gram-negative oral bacteria and gingivitis, etc. Before I conclude, I want to thank Academician Chen, Professor Lee, and my colleagues from Morris Wrigley, including Michael Doltz, etc., for helping us and supporting our research. Thank you. Thank you, Dr. Tian, for introducing a specific case of a successful application of such a self-help material that is MBE and how it helps improve our health and clean up our dental. And we still have some time for this part of a presentation. Do we have questions or things you want to discuss specific to this presentation? Yeah, I am Chen Junshi. Hello, Dr. Tian. I'm very glad to see you virtually online. I'm very glad to see your faces. I see that the years really put some marks on our faces, but I'm still glad that we are working in the same direction. I'm curious that from a commercial perspective, how is the chewing gum with the MBE commercially successful? Do you have any feedback from your consumers who buy the MBE chewing gum? Actually, when it was initially introduced in the market, the sales were wild with very good feedback. And after it was introduced to Europe and to Russia, and the feedback was stable. When it comes back to the US market, well, the picture was much more complex later. Previously, in consideration of the costs, we only add about 0.1 to 0.2% of MBE. But in actual commercialization, the content was lower in concern of keeping the cost. And this has been used as our competitors to attack us. So we have delayed the launch of these two MBE chewing gum in the US market. But from the European markets and the Russian markets, the feedback was stable and positive. We have continued with this research, and we can see, and we have seen its successful application in markets that have traditionally well received the chewing gums with mints. Hello, I'm from the China National Institute of TCM Evaluation. I find your research very engaging. That is to add MB in chewing gums. Chewing gums is a very popular food, and including my 4-year-old daughter who likes to eat chewing gums. Of course, you said MBE has many effective effects in terms of improving oral health, for example, removing the dental plaques. Because I am a researcher, so I will mainly focus on controlling the exogenous hazards control. Is MBE also subjected to pesticides or pollution? And also we talk about controlling the content or controlling the addition of MBE into chewing gums. So are you curious, do we have any research on the specific content limits of MBE addition into food? Thank you for your question, it's very good. In terms of the dosage or addition volume, actually chewing gum is a very special food, a snack. And this goes back to my previous mentioning that our initial content set is about 1.1 to 1.2%. Is this based on the toxicology research about scaling the toxicity by 1,000 times? So we have set the effective content level as 0.1%. And about the heavy metal pollution you have mentioned, and our company has strictly controlled the detection rate of these heavy metals in strict compliance to Codex and FCC. Thank you, Dr. Dian. Do we have any other questions? We have another question. Please hand over the microphone, please. Thank you, Dr. Dian, and I'm from the China National Risk Assessment Center. I have a question specific to your research. That first is MBE subjected to the east parts of MBE, the same with the parts included in the pharmacopoeia. And MBE actually is not strictly a sulfur material, but I'm curious, in the EU market or in the US market, is MBE under regulation as a food or as a medicine? Do we have contraindications? When we conduct the effectiveness approval, we have conducted research on different groups, for example, on teenagers, toddlers, adults, and we conduct research specific to different groups of population. And based on the synthesis report on these different types of groups, we can conclude that it's safe, that it's toxic free. You talk about the traceability. We mainly cooperated with the supplier of MBE in tracing, in conducting traceability, so we can ensure that MBE is extracted from Magnolias maxificis, from officinalis. I have a question from I am Shin from Taiwan University. Thank you. You have conducted a wonderful research, Dr. Tian. You have successfully launched a product which has been well received by the market. I'm curious that how did the competitors have played an active role in obstructing the launch in the US market? Well, this is more related to the product side. We conducted double-blind studies, and this has been, we have no problem with this. But when we pledged with the NDA, the biggest attack to us is that in our advertisement, we have chosen the words of a superiority, indicating or suggesting that our product is better than that of our competitors. But at that time, we don't have sufficient data to back or support. Because we don't have an exhaustive research on how superior our product is over that of competitors. So that is one thing we should hit in our future marketing activities. Okay, thank you for your answer. Hello, Dr. Tian. I'm from Pepsi. So it sounds that if I understand correctly, you have conducted a research also specific to the Chinese market. But since your research is conducted in China, why is the current marketing activities are focusing in EU or the US market? Do you have any considerations for launching in the Chinese market? Well, if we have opportunity, we would definitely consider bringing access to the Chinese market, like you mentioned. Initially, we mainly considered that the EU and the US markets can have a relatively rounded legal framework that allows for complete and exhaustive toxicology research. And EU and US markets allows and actually recognizes the toxicology research as a basis for launching these kind of products. As long as they passed the toxicology research and they are deemed as toxic free. But the Chinese market, we understand that it may need longer time to gain such access, so we didn't move yet. Actually, in Dr. Tian's presentation, this extract is 92.5% pure. It's a highly purely extracted material. And I think we need a lot of recognition work to do in the Chinese market. Okay, let's proceed with the next presentation. And this presentation focuses on China's practices. And this presentation will be delivered by Sun Xiaobo, the director of the Botanical Plants Research Institute and the Chinese Medical Academy. And I think this presentation will be made on by his colleague, but Director Sun will join us in the discussions later. Distinguished Academy Ching Chen and distinguished participants, I have to say sorry on the behalf of Director Sun. And he is on another meeting. He will try his best to be here with us for the discussions. Actually, when Professor Shim delivered his presentation, I can see that we share many similar opinions regarding the people's increasing requirements of a higher dietary for better food and better quality food/medicine. We not only aspire for eating well, we aspire for eating healthily. So I think our discussions during this morning's breakout session has been focusing on how to evaluate the safety and its health properties of the food/medicine. And from the perspective of controlling the properties of a food/medicine, the safety should be the bottom line, while the health should be something we aspire for. So I like to use the example of Aspergillus membraceus or Huangqi as a specific case. Well, let's first talk about the general picture of TCM. When in 2015, when the when a Chinese medical researcher won the Nobel Prize for medicine, the values of traditional Chinese medicines were prioritized, and even a very famous academician in medical sciences, academician Zhang Boli, has publicly remarked that traditional Chinese medicine has played an indispensable role in China fighting against COVID-19. And for Chinese TCM researchers, we have known very well about the TCM therapy for fighting COVID-19, including different decoctions in granular medicines and capsules, and also injections, etc. And in developing this TCM therapy, we have to make sure that how this TCM therapy can successfully fight the COVID-19.
On the other hand, Dr. Margaret Chen from WHO said that there is no rejection to traditional Chinese medicine, and we cannot really only rely on the Western medicine. Why can't we get some of the good medicine from the traditional local medicines. So I believe this is also give the opportunity for traditional Chinese medicines. We need to understand the treatment of exactly specific Chinese traditional Chinese medicine. What are the effective components? What are the hazardous components? So we need to use the universal terms and the languages to write the manuals so people can understand it and follow it. And this is in 2017, we got the second award prize of the science and technology competition. So here we got to, and you can see it is covered by Xinhua News Agency. They covered two cases. The first one is Mr. Yuan Longping's hybrid rice. The other one is applying Chinese traditional medicine. Naturally, the herbs for the medical purpose is very good for inheritance of our tradition. Is also important part of healthy food as well as natural treatment to big diseases. And there are more than 4,000 herbs around the world have been developed. And so the total traditional Chinese medicine totaled 800 billion RMB in terms of value, and the big house industry is over 2 trillion RMB. And so Chinese traditional medicine have been recognized and approved by most people. So on one hand, a lot of the aging population want to use traditional Chinese medicine, and the big health industry is also thriving rapidly. And you can see that the traditional Chinese medicines have been used on a wider base in different sectors and different regions and different nations. So a lot of investment that has been made into the traditional Chinese medicine. And the opinions on the health developments released by the State Council also encourage traditional Chinese medicine to play a big role in people's daily life. And however, the food medicine have been challenged in terms of its quality. There have been bigger voice that traditional Chinese medicine may end in the medicine instead of the Chinese traditional health. And in 2017, paper was published raising the concern about the quality of Chinese herbs. And it is true that in recent years, a lot of investment have been used in the planting of the herbs. And however, not enough attention has been given to the herbs quality. So here you can see another article from the China Food Safety News that the quality of herb remedies got more and more attention. After decades of efforts, the authenticity of the herbs actually now have been solved technically. For the next step, quicker testing will be conducted. But however, the quality has become barriers for the evaluation system, and we don't know, which herbs which kind of varieties is of a higher qualities. So we borrow the so we have borrowed some of the books and words from the ancient medicine books, and we also use some modern methodologies to help with its quality verification. Actually, it got a lot of attention from government and industry. Quality of traditional Chinese herbs is the highlight or priority of my presentation. And I believe this is the basic and the core of the Chinese medicine industry. And the high quality requires high level standards, and it also requires evidence to support it. It means that we need to have a systematic way to ensure the quality of traditional Chinese herbs. And with this in mind, we come up with solutions. So we need to achieve this goal in two ways. The first is the good or high quality seeds. The second is standardized plantation. This is about the implementation routes. Ask the question that how to evaluate the quality of herbs. So to answer this question, we try to come up with some technical specifications to define the quality of herbs. And in the future, we will focus on the seed development, the plantation environment, and the way of plantations. They are all important for the quality of the herbs. And here I like to share with you some specific cases in China. Huangqi will be the taken as an example for my explanation. The Huangqi has been used in China for more than 2,000 years, and the pharmapedia of 7 countries have adopted Huangqi in it, and they have been about top 10 export herbs, and they have been about traditional Chinese compounds, about 360 compounds containing Huangqi. And for Huangqi, in 1999, Huangqi is one of the pilot programs. And however, you can see that there's a few amount of plantation of Huangqi in the wild area, and most of them are cultivated by men for 2 years. And a lot of 2-year-old Huangqi have been used for the pills and medicines, and for the Huangqi grown about 5 years will be used for Chinese medicine for shots or exports. And actually for the house products, the 2-year-old Huangqi are widely used. In addition to cost, we're trying to find, which kind of Huangqi is the better. So we need to provide the scientific evidence for that. And most medicines use 2-year-old Huangqi because it's cheaper. However, people generally believe that Huangqi grow more than 5 years is better, but we don't know where it is better. So that's why a lot of scientific research has been carried out to find, which is better, the older the better or the younger the better. We're trying to find out what are the effective elements in Huangqi. It is even not very clear now. And the second question is about, which way, which product is better, the 2-year-old, the 5-year-old. And other questions we want to answer. For example, the plantation environment conditions, harvest year, pest prevention, etc. And here we can see that for the 神农本草经 and 本草纲目 have some words or descriptions of high quality Huangqi. For example, the pictures shows the high quality Huangqi. And from these words and descriptions, we try to get the basic standards or criteria of high quality Huangqi. And it should be yellow and white, and it should be flexible, and it should be sweet, and a little bit sauce of soybean. And so we try to find the basics of high quality Huangqi. And we also found that Huangqi also help with the vascular disease prevention, immune system regulation, etc. And here you can see that Huangqi has been grown in a wider range of areas, and it is grown all the way from the middle China to the north part of China. So we can see that the main producing areas, Ganxi, Shanxi, and Gansu, they are the traditional growing areas. And for the next steps, we want to do some sampling in this area to to get a clue of high quality Huangqi. And we collect different kinds of samples, both 2 years old, 3 years old, 5 years old, and cultivated varieties. First of all, we did a chemical analysis of Huangqi, so it can show 16 components. And a lot of media coverage have shown the effective components contained in Huangqi. And this analysis also shows the different amount of components in Huangqi by different ways. They can be very different in terms of different components. So it means that a 5-year-old Huangqi is higher in terms of micro molecule components. I know that Zaogan is another important effective components in Huangqi is contained in the skin of Huangqi.
And we found that the coursive wild Huangqi can actually have positive correlation between their effective component and their planting period. But the speedily planted and the speedily harvested Huangqi, there is no such relation. We also considered their effects of immune promotion And we can conclude that the fine particles of Huangqi can have positive immune promotion effects. In terms of the sensitive indicators, we also established some disturbance factors with animal tests. Actually, it's quite different to extract such factors. We use they clearly extracted elements to find the sensitivity indicators. Then we conduct research on the differentiation, on the comparison between the Pussy wild Huangqi and the wild Huangqi. For example, we conducted their effects on the anti-long fiberization, and we find that there are different derivatives in terms of anti-inflammation. It's mainly based on the two most important elements of Huangqi, and Huangqi also has effects on improving the immune system. From this system, we find that the astragaloside is quite sensitive to the fiberization, to countering the fiberization of lungs in rats. And the astragaloside can also dampen the lung fever and lung fiberization in rats. It can also reduce the conversion between the inflammatory mRNA. We also conducted research on the human's immune system. And in terms of its effect on the microcycles, we conducted research on multiple effective elements of Huangqi. And through this parallel research, we want to find out if the effectiveness of Huangqi comes from their fine particles or from their large particles. So we find that the astragalus polysaccharide has a significant effect on improving the immune system. So regarding our research on the microcycles, particularly its effects on improving the microcycle, anti-inflammation, the fine particle Huangqi provides the basis, while the astragalus polysaccharide can also play a role. And then from a chemical perspective, we can find that the wild Huangqi actually is proves to be superior than the speedily harvested and planted Huangqi. So now that the fine particled or the micromolecules of Huangqi is clear, and then we can have a better understanding of how to intervene through the planting and harvesting periods of Huangqi so as to improve its effects. And we also conduct research based on a very small genome of the Huangqi. And we found out that the genetic structure of Huangqi. But now this research is not yet finished. We'll further conduct research on the effects of the specific enzymes that are in play. And then from the quality growth perspective, we have also conducted quite interesting research on the mild droughts effect on the activeness of Huangqi. So our conclusion is that we find that the water intake should maintain quite a balanced range. Too much water or too little water intake both have negative impacts on the health healthy growth of Huangqi. And we also find that this is corroborated by the description in the Ben Cao Ganmu that the perfect precipitation to be received by Huangqi is around 400 millimeters. In terms of growing, we want to disseminate our research findings to the farmers who actually plant the Huangqi. Well, the planting techniques as for Huangqi are already mature, but there are several issues to be addressed. For example, the environment, the local climate, and the local soil properties, and also the hazards for Huangqi are still yet to be addressed. Then based on this research, based on these findings, we have conducted further research, mainly focused in the main production basis of Huangqi. We collected tons of data, established a database. The database is not yet in full play, but I think in the future, when we can have a better understanding of the nanoparticles or the micromolecules of Huangqi, then we can find more useful information from the database. For example, which factors has higher correlation with the micromolecules, and then we can intervene the growth and planting of Huangqi. This is a pesticide or hazard survey, and the pathogen evaluation of Huangqi. In Huangqi, because there are they are quite prone to hazards, so it has always been a problem with Huangqi planting that pesticides are abused. So in the future, we want to screen out which pesticide is most effective to controlling the hazards of Huangqi. And the next part is about the planting of coastal wild and scaleized planting and harvesting of Huangqi. As our research shows that the coastal wild Huangqi has better quality than that of the speedily harvested Huangqi. The problem is about the systematic continued harvesting. So now we have shifted our solution to crop rotation. For example, we have rotated the harvesting with the Huangqi and wheat and runner beans. Or broad beans. Mainly we focus on the polysaccharide, Huangqi polysaccharide. But polysaccharide, well, it has many scientific impacts. We have to consider the impact of big molecules and why these big molecules are abandoned. Previously, in the ancient period of China, Huangqi is mainly used for brewing with water. But now, since in the industrial age, since we use industrial extraction, actually many large molecules, for example, the saccharide is removed from the Huangqi extract. But in the future, we may consider more refined and advanced technologies to retain both the micromolecule and big molecules of Huangqi. So using the example of Huangqi research, can we really provide high quality medicine materials? What are the material bases? What are the mechanisms? And after the mechanisms are there, how can we ensure quality production and processing? We have some good results, but as I said, it's an ongoing work, and we need many more improvement. And this is a brief introduction of Director Sun Xiaobo. So much for my introduction, focusing on the quality appraisal and evaluation of Huangqi. I hope that we can continue with this line of work in the future, and I look forward to our discussions later. Thank you. have a question. You talked about the case of Huangqi. I'm curious to know that is Huangqi used? Do we have some examples of Huangqi used as a food? Yes, after the pilot work is disseminated, actually Huangqi has many more opportunities to be used as a kind of food. I know that some provinces have tentatively promulgated standards and regulations regarding Huangqi's use as a food, but the progress has been uneven. I know that from the industry side, we call for a speedy wrap-up of the pilot work so that these saffron materials can be widely promoted as both food and medicine. We have another question. Sir, thank you. I have another question. Thank you. I have two questions. First, traditional Chinese medicine is increasingly recognized by both the Chinese researchers and the Western research counterparts alike. So I think that the TCM is a launch and it is an unfathomable storage house for the elements. In your presentation, you mentioned about different grades of Huangqi. So what is grade? What does grade mean? And I know that Director Sun Xiaobo has introduced a paper about the grades of Huangqi. What specifically are the grades of Huangqi? My second question is that you mentioned establishing environmental factors data and data house. I'm also doing similar work about researching on the chemical elements research. But my question is that is it a reliable or is it a meaningful research threat by correlating the environmental factors and the chemical element factors? Yeah. About the first question, the grades we determine for Huangqi are mainly based on its physical appearances. For example, its appearance and its property. But of course, this is a grade by appearance. And in the future, we also hope to establish finer grades that are related to their quality, to their values, and to their effects. Right now, the grades we determine mainly for commercial uses. For example, the higher grade of Huangqi, it has a better appearance and it can be sold for higher prices. For example, the higher grade Huangqi is much thicker in its size and is more smooth in its bark, etc. So these grades right now we develop mainly for commercial uses. In the future, we also want to develop grades for based on its real values and property. Yeah, about your second question, we think that this research is valuable and it's relevant. For example, our research concludes that the coastal wild Huangqi is better has better quality than the speedily harvested artificial Huangqi. And our findings has actually delivered many other interesting findings. And we have found some differences in their properties, but the differences are they the causes or the result of many other causes is still a pending research. Thank you, Dr. Dong. In the interest of time, I will close off this part and move to the final Q&A.
可以，有作用了吗？好，既然是这个形式。
Okay, then we have the panel discussion. We invite other guests to come to the stage. including Mr. Chen Min. 4 speakers, 4 guests, please come to the stage.
谁报告先上来？再来一位。对，还有，来，别再等我才行了。
Please.
来，小哥，你不可或缺。来。
Okay, I would like to talk about 2 topics. The first one is a more general topic. We're talking about food medicine. We should not confine our minds to this list. So there are these items on this list. And one of the persons that hope is not in the list. It's not important. And hope is already used in food. And hope itself is traditional Chinese medicine. So we should not confine your minds to items on the list. So I ask a bigger question.
我们不说在药品方面发展，说食品方面的发展，你觉得当前要克服的是一个什么问题
What is the biggest barrier for this food medicine to be adopted in food? What is the big challenge?
可以从应用的角度来讲，
And it can be application challenge or regulation challenge,
从你本身的工作来讲，
from perspective of your own work.
好，我们先线下后线上。
So we start with guests on the site and then our guest online.
从它的这个社会需求和这个
In terms of
发展百姓这个健康需求来说，
economic development and public demand, food medicine has a big potential, but there's still a lot of challenges or barriers or obstacles. First of all, regulatory
的一个问题，就是
challenge,
这种非这个的保健食品
because
销售的时候，
this
这个虚假的宣传，
kind of house products marketing have been exaggerated and it's not liked by the public. So this is a big challenge. The other challenge is safety.
能够解决它这个
The medicine food can be taken in a safe way. And if safety challenge is properly addressed, they will also help the development of food medicine. As for this question, I have been working in this field for several years. Just as Zhang Li said, if it is good for the public health, food medicine has its potential. However, from medicine to food, this is still a big gap because it used to be used as a medicine and nowadays used as a food. We still need to do more research in its toxical property and attributes. And the list has been published for many years, but still a lot of manufacturers don't know how to use these items in their product development. This is also something we need to address in the future. Thank you, Mr. Ma. Actually, I'm expert in medicine. Traditional Chinese medicines have been used in China for many years. And you ask a good question. We should not confine your minds to the items on the list. Because it's based on the previous research. And there's still some potential for a longer list. And actually, in the ancient times, the doctors actually just use local medicines as the local herbs as a medicine. And for items who doesn't have any toxic safety problem, it can be used as a food. I think Mr. Ma made very clear points. As long as it's safe, the list can be longer. I'll follow up on Mr. Ma. My presentation is about quality. And I believe that in the future, the quality control will be very important. And actually, as a food, it is its control process is very clear. But as for medicine, it's not very clear. So it's different from normal food, and we need to clarify the regulations and standards in terms of medicine. I'd like to share my personal view. I think Mr. Chen, said that we should be open. We should not confine to this item. My personal view is that the food medicine should not be confined, should not be limited, should be taken into consideration in two aspects. The first is the dosage, and the second is the target group. As for food and medicine, the line can be blurry. For example, ginseng or huangqi, when the dosage is big, it can treat disease, and when it's used in small dosage, it is playing a more preventive role. And it also can be used for different groups of people as a target. So we need to think about expanding the list from new perspective. Of course, safety is still the fundamental criteria, but we need to better expand the list. So what about Professor Shen? What is your view? There's some connection problem, and finally it worked. As for this traditional Chinese medicines, I think they can give us some. We can share some lights about the amount of the dosage. Of course, we can use modern ways to do it. And it's empirical data to convince people around the world. We need to adopt some universal way, like toxical research. For example, a research on Tianma, we work with the toxical experts to do toxical research. And the testing result is also published in authoritative journal. And then only in this way, we can prove to the wider audience the safety and effectiveness of this Chinese traditional medicines. So I think the Asian books are a good reference. We should not only rely on the Western methodology like animal experiments. But at the same time, we need to adopt some modern ways and methodologies to do the research. But we also need to incorporate the Chinese principles and the cultures like yin yang, 5 elements in the research. Then we can have good results. Thank you, Professor Shen. So I have a question for you. Do you have a similar list of food medicine in Taiwan? Yes. There are a lot of discussion on this also in Taiwan. And the health authority in Taiwan also have some discussion with the pharmaceutical and food industry. And in terms of food nutrition, the preference is given to the development of food medicine because the traditional Chinese medicine is a very good, important part, and especially dietary therapy, which is not developing very good in Chinese medicine. And so a lot of training in Taiwan for the Chinese doctors is about medicine, but very few in food or dietary therapy. So we need to be open-minded. To think about to bring benefits to the 75% of the 75% population in sub-house states. And for these people who are not feeling well, not all of them should go to see a doctor. Actually, dietary therapy can be used for people in this state to improve their health conditions and prevent diseases. And in this way, we can bring a happy and comfortable life for the human being. Thank you, Professor Shen. And next, I'd like to give the floor to Professor Ma, United States. I know that it's very late in States.
Thank you again, Mr. Chen, for your open-minded thoughts. I'd like to put in some of my thought. I very much agree with Professor Shen. From the EU or US perspectives, in many cases, the EU and US markets put great emphasis on their functions on their utilities. And these functions are required to be able to be proved by double-blind tests. And so this double-blind test is required to prove its effectiveness. But you know that many elements or many TCM materials are proven effective by their thousands of years of actual usage. But it cannot be proven by double-blind tests. So let's take a step back, and instead of doing tests to improve its effectiveness, we can identify the effective elements from such materials. And you also talk about TMR, which is quite effective in countering depression. And I think as long as the TMR can be used, if TMR can be used in the US and EU markets, it can be proven, it should pass the CFDA tests. And also we can use the example of tea leaves. For example, GABA is recognized, it's a simple chemical compound and it has widely used in brewing tea. It can improve your sleep quality and fight depression. And I think this is a topic that many multinational medical corporations are pay close to, that is how to use these effective elements from these TCM materials as effective food ingredient. We also have a Hong Kong professor, Professor Terence Lau. I know that you didn't do research on TCM, but as chair, we want to hear your input. Thank you, Mission Chen, and all the wonderful presentations. I really have a lot of takeaways from this morning's discussion. So this morning we focused about the food used as medicine and medicine used as a food. This is undeniably a very promising direction. Now, right now, a lot of the research focuses on laboratory tests, for example, the toxicology research or molecular and biochemical tests. But when we talk about food therapy or food used as medicine, it has much longer intake a period than the medicine. Medicine is something you use when you are sick. It can only be used for a specific short period of time. But the food therapy can only show up its effect through a long intake period. So it is possible that in the future that we can conduct research on the longer horizon, focusing on the long-term recuperative effects of the food therapy. Actually, the effects, if we don't have this long-range research available, for example, with a time frame of a decade or 2 decades, we cannot ultimately effectively prove the recuperative health effects of the food medicine. I think right now, we have a perfect timing for conducting such long-range study, and this kind of long-range study may prove quite helpful to improving the status and credibility of food medicine. We have another chair for this breakout session, Zhao Ping. Do you want to intervene? Okay, thank you. Mission Chen raised quite an open-ended discussion, talking about the future development of food/medicine. A key word here is standardization. Whether it's a standardized regulation or standardized guidance, or whether it's a guidance standardized regarding the production, planting, or usage, we need standardization to be in place. And only with standardization can we advance a better role of food medicine, but this is also related to drafting the standards. So my keyword or my takeaway from this morning discussion is a standardization. At the last minute, we have our keynote guest is Director Sun Xiaobo, the original presenter of our last presentation. You can see that we have various speakers from Taiwan, from Hong Kong, and from the US. And we have quite a star-studded panelists here this morning. So for Dr. Sun Xiaobo, don't care what others have talked. Just as a participant to this morning discussion, what do you want to say? Okay. So for food medicine, the food medicine, its quality and its ingredients are very important. So food medicine the key part of food medicine is the herbal plants. But right now, the quality of these herbal plants are really jagged. So on the one hand, we should pay attention to the quality of the herbal plants. For example, I think my presentation focuses on the specific case of Huangqi. The qualities and the properties of 2-year growth Huangqi and 5-year growth Huangqi are different. And secondly, we need to pay attention to the varieties of Huangqi. And the specific choice of the varieties should be based on the specific chemical mechanisms. And thirdly, we need to pay their place of origin. That is, they need to be produced authentically in their places of origin. And the place of origin should inherently have better quality for soils, for the environment, and for the climate. So when we talk about the quality of the food used as medicine, we should pay attention to the 3 above mentioned factors. Thank you. In the interest of time, I'd like to close the Q&A session. I'd like to wrap up this morning's discussion with 3 key takeaways. Okay. Of half days, packed presentations, and effective discussions. If I'm allowed to brag, I want to say that the speakers we have invited for this morning's sessions are really movers and shakers of this industry. But this is not to say that they have quite important titles as directors or as presidents, but because these speakers are really the frontline workers in this field. And I think CIFSQ have set up really a prime example for having such kind of effective breakout sessions. I sincerely hope that in next year's CIFSQ to be held in Shanghai, we can have another breakout session on this theme. My takeaways from this morning's discussion are that first, actually quite some of the traditional Chinese medical materials can be used as food. Not all of them, but quite some of them. A priority choice of using TCM as food therapy is the materials that have a long established history of being eaten as food. So my first takeaway or what I want to emphasize here is that not all food can be used as medicine and not medicine can be treated as food. So what we are discussing here, food/medicine, is the overlapping part between food and medicine. Why do I have to emphasize this? I think it's quite clear from this morning's discussions. The current available evidence
这个里面有
has
很潜在的
shown that
那么有利于预防、控制我们主要的慢性病的发生。
has been very effective to treating chronic diseases and preventing diseases. So the functions or the deemed functions are quite clear. Their recuperative and nutritional functions are clear. We have two examples. And we have two examples. First is Huangqi. Actually, Huangqi also has a very tonic effect. So for example, it can enhance the flow of qi. Whether it cannot be proved scientifically, but it's there. So the distinct function of Huangqi of improving the flow of qi in human bodies is clear. For example, when we talk about treatment of cancer, cardiovascular diseases, it's not to say that these materials are only useful when they can treat such diseases. I think they are useful as long as they are good to health. That is why I'm recognized with the properties of MBE, Magnolias officinalis, as a tonic material to human body, or particularly to our oral health. So, in my opinion, is if we want to maintain good health, we cannot solely rely on medicine. We need to use food or food therapy. Food, aside from keeping us from hunger, can also help improve our health, prevent diseases, mitigate sub-health, etc. So this is our aspiration that food should increasingly tap the potential of being used as medicine. An important prerequisite is first it needs to be safe. And secondly, it should have high quality. I think the biggest obstacle, one of the biggest obstacles to TCM is that the quality is jagged. For example, the quality of Huangqi varies in different places of production. And food, if they are there to be used as food, they need to have good and reliable quality. So using example of MB, I think Miles Wrigley has really set a very good example of which is already proved by FDA. I think it has very clear quality specifications for the extract of. So the extracts of BE in different batches need to have strictly the same quality. Safety, quality, and thirdly, functions. That is why I encourage you to step outside your silos and instead of focusing solely on the catalog, you need to focus on the functions. As a producer or a commercial supplier, if I would use the catalog, you need to specify what functions the different materials can provide. That is the point of having this catalog. So, on the one hand, we should inherit the wisdom of TCM through thousands of years of civilization. And on the other hand, we have to use modern medical sciences to try to prove its functions. Professor Timimi made it very clear.
Clinical trials are very important. The blind double cross experiment can prove the effectiveness of the food medicine. This morning's session is very informative. In my personal experience, my friends in foreign countries in the fields of food safety regulations and nutritious studies all believe that Chinese medicine have a lot of good things and good stuff. And so we have the responsibility to prove their benefits and shared with other parts of the world. And actually, it's not about its function. It's more about the safety. Because my foreign friends said that we don't know whether it's safe or not. And we don't have, as for the management department, they cannot do the complicated toxic experiment. For example, Tafsa Malco said that, whether you can translate all these materials from Chinese into English to give us a better view of its safety. So I just want to say that the world is paying attention in this area, interested in this area, and as a Chinese experts and practitioners, we have the responsibility to do more research work to prove their health safety. So this is the end of this morning session, and I hope to see all of you again next year.